worth 1,000 words, and a fresh set of pearly whites will set you back around $1,000 at the dentist. There's plenty of cheaper at-home products too, like whitening toothpaste, strips and gel kits. So let's start by taking a look at good old-fashioned toothpaste, the cheapest of the bunch.
They're going to micro-abrade the teeth. So they're not going to whiten the teeth, they're just going to polish and clean the teeth. Either they're a stick-on product where you stick it onto your teeth, a little band, or they're a paint-on system. And I tend to crack the joke in the office that you end up whitening your stomach, not your teeth, because you eat it all.
The whitening products are mostly bleaching agents that contain peroxide. The thing that changes between products is the concentration. Now, it's often thought that the cheaper the product, the lower the concentration, but this isn't always the case. Some work better than others, and dentists claim that you get what you pay for.
Dentists are using a concentration of about 30 to 35% to get a white result, and that's an ideal number to use. There's people in the marketplace that aren't dentists, that aren't trained, that are using between 5 and 30% to whiten teeth, and that's really a dangerous issue.
The reason for the danger is that you're talking about putting serious chemicals in your mouth, which, if used carelessly, could cause harm.
There's probably 3 ways, Casey, that a dentist can whiten your teeth up. The first way is to make some trays. You put a little bit of goo in, well, specifically put some hydrogen peroxide in there normally, or carbamide peroxide, put in your mouth, and wear that for half an hour or overnight, depending on the brand and the material. The materials that are mixed together on the spot are more effective, and that's normally a price point between $0 and $500. The second way to go about it is to sit in the dental chair for 1 hour, isolate all the teeth, so nothing can burn and nothing can get exposed to the light or the whitening agent, and have whitening material, peroxide or carbamide peroxide based material painted on your teeth, and then that is activated with a light source, and actually what it technically does is unravels the coloured molecules in your enamel, and that's normally around the $500 to $1,000 mark. The third way is to use a laser activated light source, around about the $1,000 to $1,500 mark.
So how often can you have it done?
Well, normally we see people that come and have it done once, Casey. Maybe a better question is how often not to do it. In the industry, we call it a whitening junkie. So if you're a whitening junkie, you can do some damage to your teeth. You can do a lot of damage to your teeth, because you get to a point where whiten, and then it won't do any more good, and it'll actually do negative good.
I mentioned earlier that a high concentration of peroxide can damage the mouth tissue, but a more serious concern is whether the bleaching agents in teeth whitening products can cause cancer. I asked a world expert in carcinogenesis.
Hydrogen peroxide is an extremely reactive material. It's what is termed an oxidising agent. When in a test tube it's mixed with genetic material, DNA, it's capable of modifying that DNA in the same way that certain carcinogens are capable of modifying DNA. So simply in having that capacity, there's cause for concern if it's in contact with human tissue.
So how do we get away with using it in things that we put in our mouth?
We are fortunate insofar as not only do we have teeth that need whitening, but we also have an enzyme called catalase. Catalase breaks down hydrogen peroxide more quickly than it can possibly get to the DNA of cells lining the mouth. We're in that happy category where we can say the evidence is that these products do not present a risk of cancer to people.
What about co-carcinogenic effects?
That term relates to the scenario of 2 agents, each of which can cause cancer, acting together. And the classic example is close to home in the sense that we're talking about oral cancer. The worst possible scenario for oral cancer is people who both smoke and drink alcoholic beverages. And it's known that risk of oral cancer increases multiplicatively by comparison with either the impact of tobacco smoking or the impact of alcoholic beverages. Now, if tooth whitening agents were to have an effect, one might expect they might piggyback on the effects of either alcohol or tobacco or both. But all of the evidence that is available, including the site at which tumours develop, the absence of inflammatory responses due to tooth whitening products, and the actual detailed characteristics of alcohol and tobacco smoke as carcinogens, all of these things suggest that indeed there's no co-carcinogenic effect with hydrogen peroxide.